Good morning. My name is Jennifer Robum, and I'm a clinical psychologist and clinical professor of medicine and behavioral science for the Family Medicine Residency of Western Montana. I'll be talking to you today about climate change and mental health, the mental health impacts associated with the climate emergency, and steps our communities can take to promote greater psychological resilience in the face of the climate crisis. In a later segment of the webinar series, I'll talk about self-care strategies and resiliency attitudes that Montanans, including practicing health professionals, can adopt to protect and promote their own mental health in response to climate change. The learning objectives for this introductory segment are, first, to provide a broad overview of the mental health impacts of climate change, and second, to discuss mental health challenges that Montanans are already facing and the resources that are currently available to address them as we prepare for greater climate change. If we look closely at this map of the United States from the Medical Society Consortium on Climate and Health, you can see that the health impacts of global warming will be uneven, creating different hazards in different locations based on geography, temperature, weather patterns, etc. Regardless of the region of the country, however, we can anticipate that the threats of climate change toward mental health will be somewhat ubiquitous, as demonstrated by the appearance in almost every region of the map of the dejected seated figure who represents mental health difficulties. An individual doesn't have to experience a climate change-related disaster for their mental health to be impacted. In fact, if you were drawn to participate in this webinar series, your mental health may have already been affected to some extent by attention to and concern about climate change. According to Climate Change and Human Health in Montana, a special report of the Montana Climate Assessment published in January 2021, we can expect earlier snowmelt, large wildfires, spring flooding, late season drought, and extreme weather events in Montana in coming years, all of which will challenge important aspects of our environment, economy, infrastructure, and well-being. The report also noted that Montanans will experience increased stress and increased mental illness related to climate change. I'll be talking today about 3 different pathways through which mental health in Montana will be impacted by climate changes. First, adverse mental health impacts due to direct or acute exposures to climate change-triggered natural disasters or weather events. Second, mental health impacts due to exposures to chronic, cumulative, or slow-creeping climate-related stressors, such as rising temperatures, drought, and wildfire smoke. And third, indirect mental health impacts due to awareness of and anxiety about the climate emergency, exposure to climate change-related information and images, in anticipation of future losses and damages associated with the climate crisis. Although I'll be talking about the mental health impacts of climate change in isolation today, we all know that mental health is intimately connected to both physical and community health, and thus these impacts will have important implications for the health of your patients and of your communities more broadly. Likewise, some of the health impacts of climate change reviewed in other segments of this webinar series will impact the mental health of Montanans dealing with them. I'd be remiss if I didn't stress that climate change will be a threat amplifier in Montana, as it will undermine the social and environmental determinants that support good health. It will also exacerbate social, economic, and demographic inequalities. The mental health impacts will be inequitably distributed throughout our state, with the bulk being borne by marginalized and susceptible populations, including children, the elderly, the poor, those with pre-existing mental health conditions, Native Americans, those living in rural and under-resourced communities, and first responders. As in the COVID-19 crisis, it's also possible that health professionals caring for Montanans whose health has been affected by climate change will also be disproportionately impacted. Some Montanans will be particularly vulnerable. For example, a Native American teenager in a rural community beset by drought who is already struggling with suicidal thoughts might be at especially high risk for mental health impacts due to climate change. This highlights, from an environmental justice perspective, the harsh inequities related to climate change, as many of those least able to deal with the mental health impacts will also be among those least responsible for causing it. Importantly, these mental health impacts will occur in a state that's already struggling to meet existing mental health needs. For example, according to Mental Health America, in 2020, Montana was one of several states with high rates of mental illness in adults but low access to care. The Substance Abuse and Mental Health Services Administration estimated that there were 90,000 adolescents and adults in Montana with a substance use disorder in 2019. And Montana consistently ranks in the top 5 states in terms of its suicide rate. It ranked third in 2019 with a suicide rate of 26.17 suicides per 100,000 population, close to 2 times the national average. In terms of access to behavioral health care services, I should note that 55 out of 56 Montana counties have been deemed mental health professional shortage areas, according to the Montana Department of Public Health and Human Services. This is demonstrated by the graphic on this slide from the DPHHS website. While telehealth services during the coronavirus epidemic have expanded access to mental health services in some ways, anecdotal evidence indicates that many therapists have no openings in their caseloads and are reporting long wait lists. Budget cuts in 2017 adversely impacted the behavioral health system in Montana, and the House of Representatives focused on other priorities in early 2021, choosing not to restore budget cuts to healthcare, mental health, and suicide prevention services. This suggests that access will continue to be a challenge. Those of you who are practicing in rural communities in particular are already aware of the challenges you face in Montana when trying to refer patients for treatment for substance use disorders or psychiatric conditions. It'll be important to remember these statistics as we talk about additional mental health challenges we can anticipate in the face of climate change. Finally, I wanted to draw your attention to a recent report out of the Johns Hopkins Bloomberg School of Public Health and Trust for America's Health, which rated all 50 states in the U.S. in terms of their vulnerability to and their preparedness for climate change. A state's overall vulnerability was determined based on a number of measures of exposure, sensitivity, and adaptive capacity, and these varied depending on environmental, social, and demographic factors. A state's preparedness was determined based on a number of dimensions of public health preparedness and climate-related adaptation. Importantly, vulnerability can vary over time and place in any given community and across life stages for any one individual. Nonetheless, Montana was among the states least vulnerable in the short run to climate change, largely due to its relative protection from severe storms and disease vectors. I want to note, however, that Native American communities were not included in these analyses due to a lack of comparable data, which would have assuredly increased Montana's vulnerability rating. Importantly, however, among those states that were least vulnerable, Montana was also found to be among the least prepared, due in large part to its low behavioral health care score, which was a 3.5 out of 10. This score was a measure of provision and facilitation of access to behavioral health services. This report highlighted the importance of attending to mental health in Montana as we prepare for climate change. So, in summary, I'll be talking today about a number of pathways through which mental health in Montana will be impacted by climate change. These climate-related impacts will exacerbate or be in addition to significant mental health challenges already experienced by many Montanans in a state that's already struggling to meet basic mental health needs and is not well prepared to address climate change, particularly its associated behavioral health impacts. In Montana, we'll need to be proactive, creative, and resourceful in addressing these mental health needs at the individual, community, and state levels. Thank you.